All right, well, we're going to go ahead and get everything started for today. I'd like to welcome you to our joint learning collaborative for the month of March. Today, we are featuring one of our NCLEX trainers, Melissa Bellamy from Morgan State University, as well as several of her colleagues who will be assisting us with today's discussion about how to teach clinical judgment through the use of the case studies. And the case studies I know that we'll be featuring today is a resource that we previously shared with you that was through Maryland and their initiative that they had with the case studies. So I'm excited to bring this discussion to you all today. Please make sure that you ask all the questions that you can. We will have an activity, a breakout activity with some of Melissa and some of her colleagues. So with that, I'll turn it over to Melissa and I'll let her take it away.
So hello, everyone. My name is Melissa Bellamy. I am the BSN Curriculum Administrator, Professor of Practice at Morgan State University. I have a background in emergency room nursing, and I've been in academia for, I guess it's almost 5 years now, since 2018. So what we're going to talk about today is how we utilize case studies in class. So the beginning part of my presentation is just going to talk about a little bit leftover information about what Monica discussed in the last collaboration meeting in February. So she just kind of introduced us to the NextGen test plan and some of the things that we're going to be changing. So the beginning part, I just elaborate on some of the changes and then we'll move into the case studies. So the purpose of this presentation is pretty much so we can develop some additional tools so how we can increase clinical judgment in our students in the classroom setting. So some of the things that we know that we already do, we utilize simulation, we do dialogue, mind mapping, and then case studies. So that's what we're going to be talking about today. So with this presentation, you guys should be able to understand the NextGen test plan. So what's changed with the test plan. I'm going to outline some basic best practices for exams to kind of mimic what the NCLEX is going to look like, and then also how to implement case studies into the teaching practices. So the first thing is the NCLEX test plan. So the test plan still going to have some of the same information as it relates to the 8 content areas. So our management of care, safety and infection control, health promotion and maintenance, our psychosocial, integrity, basic care and comfort, pharmacological, reduction risk, and then our psychological adaptation. So all that information is going to stay the same. The information that's changing is the clinical judgment case study. So within the NCLEX test plan, there are going to be 3 clinical judgment case studies. So for each case study, there will be 6 items. So a total of 18 items are going to be on the new NCLEX starting in April. So also with that, the minimum requirement of test questions is going to increase some. So before it was at 75 questions, they're now going to be a minimum of 85 questions with a maximum amount of 150 questions. And this is how this content breaks down. So 52 of the items are going to be from these content areas to the left, where 18 items are going to be the clinical judgment case study, and then 15 items are going to be unscored pretest items. So the next part, I'm just going to talk a little bit about scoring. So how is the NCLEX scored? So this information is significant because we need to know how to adapt and change our testing models within our programs to make sure that we're giving students the best experience to know how they'll be able to be as successful on this NCLEX. So the first scenario is the 95% confidence interval rule. So pretty much what that is, the test will shut off when they have determined that the student has maintained at least 95% confidence level. So this can be at the 85 questions. So we know before, students always say my exam stopped at 75 questions. So at the 75 questions, they were determined that they were 95% certain that they had the ability of the information. So this is going to be the same kind of scenario. So at 85 questions, or whenever they determine that the student has met that 95% confidence rule. So it could be at 85, it could be all the way through 150. The second scenario is that the student has reached the maximum length. So this means this student is going to get all 150 questions on the exam. And then the 95% confidence interval rule kind of eliminates, and we go to the final ability estimate. So if the standard, so whatever the national standard is for passing the NCLEX, if the student has met that standard, then they've passed. If they don't meet that standard, then they will be unsuccessful on the exam. And this is once they reach the maximum length. The third scenario is going to be the run out of time rule. So this means the student has run out of time. So the timing for the exam is 5 hours. So they have about 300 minutes. It equates to 300 minutes for them to take the exam. So if they run out of time, whatever amount of questions that they've completed during that time is when they'll use the final ability estimate rule based on the amount of questions that they've answered. So if they, again, met the standard, they will pass. If they did not meet the standard, then they won't be successful on the exam. So the reason why this is significant is because we want to make sure that the students have the ability to be able to sit through an exam. So some exam recommendations that I've made is that we make sure that our exams fall between that minimum of 85 up to the maximum of 150. So the 150 will be more useful for probably like midterm exams, final exams, when we have a lot of content, whereas though the 85 questions will be useful for our regular standardized exams that don't have a lot of content. So this allows the student to be able to know that they have to sit through this amount of time, so also they don't run out of time. So then that goes into the next point of giving the students the time frame of about 1.5 to 2 minutes per question. So by doing this, we talked about the overall exam is 5 hours, which is 300 minutes. So for whatever instance, if the student does receive the total of 150 questions, then they have 2 minutes per question to complete the exam. So we want to incorporate in our exams that 1.5 to 2 minute time frame, just so the students don't get to the NCLEX and then they run out of time. So on those easier questions, if they can kind of breeze through, they'll have more time for these next-gen case studies that we're gonna get into. And then the last recommendation is that we are incorporating at least about 20% of our exam for those clinical judgment case studies. So as I said before in the previous slide, there'll be 3 case studies on the NCLEX exam, with each having 6 items. So a total of 18 items are going to come from this next-gen clinical judgment case study. So that equates to about 22% of the exam. So that's why I recommended about 20% of our in-class exams to have this amount of content on it so students can start to get that exposure. So not mentioned on that previous slide is just information about being able to collect data. So when we're if you have processes, I'm not sure what type of exam programs you guys use. We use ExamSoft at Morgan State University. So we're able to code our questions based on the client needs, based on the clinical judgment, the NCSBN clinical judgment model. So if it's a recognized cues question, analyzing cues or prioritizing questions, we're able to code it that way. So that way we're able to identify the areas of remediation for the students. So if they're having some specific areas and we notice we're prioritizing or analyzing cues, then we can really remediate on those areas. All right, so now the case studies. So do you guys, is anybody already utilizing case studies in their classrooms, and how are they already utilizing those?
This is Linda from FAMU. We are using case studies, and it is integrated into the flipped classroom modality. So PowerPoints and the like are provided to the students to review. And then that application piece is utilizing the case study in the classroom.
This is Courtney Nyange, and I should say I have been piloting the use of some case studies in the classroom in our final senior semester, the integrated concepts course, which is like a big review course for preparation for NCLEX and everything. So I have started using these case studies in that course to, expose the students to the content and just get them to, practicing these types of questions.
Okay, that's great. So one thing that I wanted to add, which the first person said, we use case studies with shadow health. Okay. One thing I wanted to say is that in order for us to really implement these case studies and get the best out of them, we have to make sure that the students already have that background knowledge about what we're going to be presenting the case study on. So just, I was thinking of it more so as like the Maslow hierarchy of needs. So we know at the top of Maslow hierarchy of needs is where problem solving happens. So if we are implementing these case studies and then the students don't have these basic knowledge. So for instance, one of the case studies that we'll discuss today is asthma. So if patients, I'm in the hospital now, let me get back to, so if the students don't understand how asthma works, how the respiratory system works, how it affects their breathing pattern, it's going to be really difficult for them to be able to make clinical judgment decisions and be able to have interactive conversations about what they would do for these patients. So my recommendation before we even implement the study is to make sure case studies is that we make sure that we've already lectured on the material first, whether it be like voiceovers or actual lectures, and ensure that the students have already read the material. So we should kind of send out some pre-work for the students to ensure that they already have the basic information and background that they need to be able to answer through these case studies. So some of the things that the case studies are going to kind of do is it walks us through all the steps of how so we have our SBAR format. So it's going to give us all the patient information. And then from there, it's going to break down the 6 NSCBN model, the clinical judgment model. So the recognizing cues, the analyzing the cues, prioritizing, generating solutions, taking action, and then evaluating. So those are going to be all the steps. We also want to make sure we instruct the students first about what they should be looking for throughout these case studies. So as much information that we can give the students ahead of time to kind of prepare them will be best so that it can be interactive. Because when we're utilizing these case studies, it's more so for the students to be able to provide us feedback and not really us teaching anything. We shouldn't really be teaching anything when we're utilizing the case studies. We really should just be giving them the scenario, and they should be able to pick out and identify these 6 concepts. So what I want us to kind of do at this point, if anybody has questions about anything, first we can do some questions, and then I want us to break out into breakout rooms, and we're going to look at how to go through these case studies.
Okay. Any questions before we move on to the activity?
I was also going to say before we break out, I didn't introduce my colleagues.
Yes,
so
please.
yeah, sorry about that. So I have so myself and Pawn Johnson Hunter, we're all from Morgan State University. Myself and Pawn Johnson Hunter, we attended the AARP NextGen training. And then my colleagues, Joshua Saylor and Angela Davis, they actually worked with the University of Maryland team to write case studies. So the case studies that we're going to be reviewing today were actually written by Professor Joshua Saylor and Angela Davis, which are on the call.
Well, Melissa, I'll hand it back over to you for sharing and Q&A.
Yeah, so the first thing I know in my group, we specifically went over the student version, and I think some of my colleagues may have done the teaching version. So I just wanted whoever felt comfortable enough to share what they learned and what they thought about the version that they went over and how they felt like they could implement it into their classrooms.
Sure, I can speak on that. It was nice to see it from the student side, so I can know what the students will see and what they'll be able to download and turn in, so when you're trying to plan assignments and all of that stuff, you'll know. I definitely think the pre-work is going to be crucial to being able to do this in class, because that's the way I envision utilizing the case studies, is for them to come to class and we do it together and I can see how they're answering questions and see their thought processes unfold. So we talked about kind of them doing sort of a mini care plan beforehand where they would kind of go over the patho and maybe do some drug cards for some of the medications and things that they would be expected to know about and for that specific disease that the case study is covering. Even vital sign parameters, because this was a PEDS case study, and so needing to know the difference between the vital signs with PEDS and adults so they can know what's normal and abnormal. Yeah, and I would even take it a step farther and have them go through, at least writing out the rationales for interventions and things so that they know why or whatever they select, what it's supposed to do. So that way, when they evaluate the outcomes of it, then, they'll know if it was or wasn't effective. So yeah, I enjoyed it, appreciated being able to see it and go through all of the 6 questions and see each step of the clinical judgment model.
And I was also in that group. And I think that the students do need preparation, and I liked it because it kept circling back around with the same information. So the students are kind of forced to think it through. Here's the information again. So here's your next opportunity to think a little farther into what it's asking. Like, here's the symptoms. Okay, now here's the meds based on your symptoms. Now then here's the next part. So I think that that's really good. And I think it is a good in-class activity because then you're able to have a little more explanation and deeper conversation, where when they study on their own, sometimes they skim through it, but they may not get it fully. And then as you're talking through it, they kind of, especially as more students are engaged with the information, they kind of will explain to each other. Also, as the faculty can orchestrate the conversation, but the students can also help with that.
Any other comments or questions with regards to the case studies you went over? And even any takeaways from the presenters on any of the case studies or interactions that you had in your room?
Well, I'll just piggyback off of some of the things that I've already heard. I think that it was very helpful that that it is an unfolding case study, and seeing we only got through 2 questions, but we still were able to see how the case study was set up and how it flowed from one question to the next question, utilizing all of the assessment and evaluation data that they had already received. So I think being able to use that platform and help the students to move through those stages is gonna be very important, but I think it'll all make sense to them. I really do. I think it'll all make sense to them because that's what they'll be doing in a clinical setting. So I think it works well.
Great. Any other comments or questions? Okay, Melissa, I'll hand it back over to you to continue on with the presentation.
So on this next slide, I just provided some resources. So the first one is the link. It should be a direct link. And if Jasmine didn't send it out to you guys already, she can send the presentation. But the first one is the direct link to the NCLEX test plan. So this has some of the information for the blueprint that I attached, but it's a 59-page document. So it really goes through everything inclusive of what the test plan is going to be about for the new one beginning in April. The next link is going to be the University of Maryland NextGen Test Bank. This is faculty. So this is a PowerPoint presentation that actually walks you through as well how to utilize the faculty case studies. And then underneath of that, that link is directly to the faculty case study. So for my colleagues who presented those, they look a little bit different than the student versions. The differences in those is the faculty case study provides the answers along with the rationales within it, whereas though the student version, as they literally go through, they have the information, they answer the questions, and then they just get like a PDF download. So they can download it, submit it to you as an assignment, but it doesn't give them any feedback on what the answers are. So the faculty members still would have to provide feedback because it won't provide the answers on the student version. That fourth link is a PowerPoint presentation giving you more information of how to utilize the student bank. And then the last link is actually the student version bank. And then the last slide is just where the information was retrieved from. So it came from the NCSBN, the test plan, and then through the University of Maryland, it was a Maryland Nursing Workforce Initiatives. So all this stuff is on their website, and it is available for us to use for educational resources. So there is no blockage. We can use it in our classrooms for educational purposes. And that was all I had for that. If anybody has questions or comments.
Melissa,
Yes.
first of all, I really want to thank you so much for the clarity of your presentation and for really engendering some deep thinking about this. I'm really happy with what you've done. Thank you so very much. And then I have a question. So I did click on the Maryland NextGen Test Bank. Thank you for all of you for making this available to us. So my question is this open access for any of us who want to use it, or is this protected?
I can speak to that.
Yeah.
This is open access, so anybody wants to use it for educational uses can use it. The one caveat I would give you, since it is new, I wouldn't necessarily use some of these questions like straight for your examinations, because you know how students, once they learn about things, they'll eventually find ways to get this because this is out there. But these can definitely be used within your schools, within your practice, in your classes. And we're going to try to continue to add to that, this test bank as we go. So if anybody has interest in that, they can contact me or Professor Davis, and we can point you in the right direction on how the templates that we use, and all these are peer reviewed to make sure that they fit the standard that we expect.
This is just really wonderful. I am so grateful. And it is a nod to the equity that you are providing. Thank you. I am so grateful to you.
Thank you. We also ask that once the students have this, please, it's protected with the faculty, that only the faculty have the answers. Because as Professor Saylor said, once they have the answers, then that critical thinking, judgment, and all that stuff is like pretty much out the door, because then they won't think.
That's right.
So.
Dr. DeWitty, yeah, I see your hand is up.
Yeah, I have a question for all of the facilitators and the faculty who presented this. And what I'm curious about, what kind of recommendations or suggestions you might offer to faculty so that they will be better able to incorporating this new way of teaching into their classrooms. And as I was listening at it, I thought a lot about some years ago we used to think about the flipped classroom, whereby all of the reading and the studying was done prior to the student appearing in class, and when you come to class, you are expected then to apply what you have read and what you have been learning. So I'm wondering, in terms of facilitating and really accelerating this critical thinking for students, since you've been doing it for some time, what kinds of recommendations or suggestions you might make for faculty in terms of how do you really make this come live every day in the classes that you teach?
Dr. DeWitty, I think you hit the nail right on the head there. We try very hard to get our students to come prepared to class. They're all collegiate students that, our expectation is for them to not just be spoon-fed information. And I find that's a struggle that myself and many of my other colleagues have, is finding the importance to get them to get some of the material before, so I don't have to go over the basics. So we can just kind of skip the basics, go straight to the dessert, go straight to the critical thinking, and that's how we got to get there. We do different things. Some of ours we use like some of the Lippincott, the course point stuff, and we do prep use. That sometimes we expect our students to maintain a certain score each week prior to class. That's one of the things that we try to do. And then other times, you know, I know in my classes, sometimes I will even voice over some of the basic material for them to listen to. So that way, when we're in class, we can talk about the lecture. Because I understand sometimes they still do want to be spoon fed. So sometimes I will give them their lecture ahead of time. And then when we come to class, the expectation is, hey, you should have at least listened to that. You know, if you're not going to do all your reading, I know you're busy. I know there's all these things that are distractions, but come to class with some knowledge so that we can help you become better nurses, better clinicians, because you have that critical thinking. And so I think it's a struggle that we all have, but we have to try to figure out ways to get students where they're at and utilizing the technologies that we have and the technologies that they are used to using on an everyday basis.
And some of the suggestions as far as incorporating some of these next generation case studies into your classroom. Some ideas may be having your students work in small groups after you've probably done a brief lecture. And they can work in groups and answering the questions. And then after that, you can possibly go over, see how they're thinking as far as a group. And then you can also reinforce their learning by having the students write probably an S-bar report of the case that was already presented. They can also, you can also probably have them take a quiz, complete the standalone items. Were you able to see any of the standalones? Were you in Professor Saylor's group?
No,
We didn't get to that.
Okay.
We didn't get there either.
Oh, okay, yeah. But those are some other options as well. And also too, as Professor Saylor suggested, it could also be used as a ticket to class. Maybe if you've given them or just prepping them before class, maybe the case study could be used as a ticket to class, because as Professor Bellamy stated, the students can go in, answer the questions. And then once they've answered all the questions, it would download as proof that they've taken it as another way. And let's see. There's multiple ways as to how. Any other suggestions? They can also create a paper based on the case study and give responses back to you. So it's several ways that it can be used. What I also like about it too is that it also gives the student knowledge on how to look at charts and be able to, do you notice that sometimes that they kind of lack that in some areas, looking into charts and being able to gather up information to make a critical analysis sometimes of things. So that's what I like as well too. And according to this new test plan that's coming up, they said that the students they should at least receive no less than 3 or see at least no less than 3 of these next generation case studies on NCLEX. So it's a good way to get them used to all the 6 areas, such as the recognizing, analyzing cues, developing the hypothesis, and so on and so forth. I hope that helps.
I'll just say for my class, one of the things I've started doing recently is being more collaborative with the clinical faculty and gauging more of what they are seeing in a clinical environment and talking with the clinical faculty and letting them know some of the things, some of the items that they are missing on exams collectively as a class. So if there's an item that was tested on previously that a case study could help elaborate on that information, what I've been doing recently is collaborating with clinical faculty to identify if there is something in a clinical setting or a patient that they have been exposed to, or a patient that the clinical faculty are aware of that is on that unit that students may be able to see. And then we can circle back in the classroom and go over it again, just for clarity to make sure that they understand. Another thing we've been doing is I've been having them go to the lab for certain topics prior to coming to class. And they do get the pre-work before going to the lab. And what we do is, what I've been doing is rotating students out. So half of the students will go to the lab first for some of the session while I'm in the classroom with others, and then we'll rotate out as they finish. I hope that helps.
Yeah, thank you. Any other questions or comments?
I'll share a quick story from many years ago when I was a nursing student. This was before, of course, all of NextGen and all of that. One of the ways that we were taught, I attended an HBCU, Dillard University in New Orleans. And one of the ways that we were taught, and I remember Dr. Goods to this day, we had to prepare a plan before we reported to the clinical environment. We would be given some basic information about our patient, and we had to have a plan that looked a lot like these case studies that I'm looking at now. And then at the conclusion of our time in the clinical setting, taking care of that patient, we would go back to that plan, we would update it, we would put additional information, and once again, apply that critical thinking to what we saw, what we learned, what we did, and what the outcomes were. So it really connected that clinical practice to the theory. And I think that was a really good way to really connect those pieces so that, doing this kind of thinking became really, it was part of what you did in the clinical practice as well as in the classroom. And when I heard Dr. Johnson Hunter talk about how she's connecting with the clinical faculty, yeah, it reminded me of some of the teaching methodologies that were used many years ago. Seems like we've come full circle.
Thank you, Dr. DeWitty, but not quite yet, soon.
Great. Any other thoughts or questions while we have all of these great presenters here today? Okay, well, if not, I do, before we close out officially for the day, it's been a long time coming for some of our Learning Collaborative participants that I'm excited to finally share our NCLEX Train the Trainer website. It is live, it is active, and so we're encouraging you all to go on there, learn about our NCLEX trainers, and if there's one or two that you're interested in reaching out to potentially have any type of training or engagement for your faculty, please do so. They are here to support the schools that we work with, as well as I'm sure they're supporting their programs and others as well. But, we have trained them with the National Council of State Boards of Nursing for these types of trainings. And so we encourage you to touch base with them all. And if you have any questions or need additional support, you know that myself and Wynn are here to assist you. So I just wanted to close out with that, and I will be sure to share all the links and the recording once it's available. And so just thank you everyone for joining.
That's one quick. Are we still going to do the session for students?
Yes, we're still working on doing the session for students. So once we have that date in mind, we'll let all of you know. Yep, but we're still working on that.
Did we say anything about the summit?
If you'd like to, yeah.
Okay. And before I talk about the summit, thank you so much, Melissa, and to all of your colleagues that
Absolutely
helped facilitate. And Jasmine, great job as always. Thank you for producing this program today, and all of the team that helped Jasmine organize it. So we are hoping that on October 3rd and 4th, and if not, it will be November 1st and 2nd, that we are going to host a day-and-a-half health equity summit, Achieving Health Equity Through Nursing Summit, the AARP and the Campaign for Action. And we are looking for a hotel location here in the Washington, D.C. area. And it's going to be very hands-on, very workshop oriented. And the first full day will be tracks for work. And one of those tracks will be mentoring. So we are hoping that one, maybe more, but right now, depending on how many schools say yes, one school from each of the minority serving schools of nursing that we work with on our mentoring support program will join us that day. So all 3 sets of schools of nursing will be together in that first morning as a review of the overall themes that we try to provide technical assistance on. So it includes NCLEX preparation, recruitment, mentoring recruitment, and fundraising. And we might add a 4th topic about viewing your students as your future faculty and preparing them professionally. And then in the afternoon, we were envisioning that the 3 sets of schools of nursing would go into various areas of the large ballroom or maybe a breakout room, and you could do a refresher on the curriculum, the mentoring curriculum itself. So it will be a great opportunity for all the schools to A, meet each other together in person for the first time, and B, to also the Hispanic serving schools and the American Indian Alaska Native serving schools have never been together in person. So it'll be the first time that you're meeting in person, and then all of you would be together in person, so we are very excited about it. And when we send out the invitations to this summit, it will include language that if you are, I don't know exactly how the language will be, it will be grammatically proper, but it will basically say that if you are in need of funding support for travel for the conference, to please let us know. So, so anyway, if you could hold the dates of October 3rd and 4th, I think I might have said the wrong dates earlier, October 3rd and 4th and November 1st and 2nd. So big things.
Thank you. Thank you.
Yes,
You're
thank you,
welcome.
Lynn. So more details on the summit and all of that will be coming in the following weeks or months once that's available. All right. Great. Well, thank you all so much for today. And I do believe the next couple sessions that we have will probably be office hours with our NCLEX trainers, just that way any last minute questions, any last minute assistance that you need before the test is released, we can address. But we'll share that more in the coming weeks. But thank you again.
Thank you, everyone.
Thank you.
Have a great day.